Okay, I think we are currently live and we're good to go. So welcome and thank you so much for joining Student Health Services today. Our clinicians are here to answer all of your questions about the flu and the flu shot. My name is Vera Verhelder Dios and I am a health educator at Student Health. We have so many knowledgeable people with us today. We have Dr. Walker, who is our medical director. Valley Cohen is one of our nurse practitioners, and Carmita Valise is one of our registered nurse specialists. Thank you all for taking time out of your day to speak directly with students and answer some burning questions that they have. Sure, go ahead. I don't know, Dr. Walker, if you wanted to say something.
Oh, so I hope you are all thinking about the flu and how to avoid it, and the best measure you can take is to get a flu shot, and we hope to cancel any fears or concerns you might have about getting a flu shot.
Absolutely.
Yeah, I agree with Dr. Walker. And so many people think, oh, well, forget it, or it's too hard, but it isn't hard to get. And it's really, really important for you as well as the world, really.
And the flu vaccines are available, and you can still access them now, and some places will be able to give these free. So it's easy.
Great. And we have all that information on our social media accounts, so you can find out where you can get a free flu shot or a low-cost flu shot that's in your neighborhood. But today we're talking about the flu. So let's get started with probably the first question on everybody's mind. What is the flu?
So the flu is the name most people use for the viral infection caused by influenza virus, flu virus, that usually affects the nose, the throat, and sometimes the lungs. The usual symptoms sound like almost every other viral illness you get, with fever, cough, muscle aches, headache, runny nose, fatigue. And so there's lots of things that can look like influenza and yet not be flu itself. The symptoms can sometimes be mild, but sometimes they're very severe, and people do, even healthy people, die of flu illness. And it spreads very easily by coughing, sneezing, touching contaminated surfaces, whether that's counters or shaking hands with the person who has flu and has wiped their nose with their hand, and then touching your eyes, mouth, or nose, or sharing drinks and eating utensils.
That kind of sounds like it's really similar to COVID in the way that COVID spreads.
It's very similar, and in fact, one of the only probably distinguishing feature for COVID is if the people with COVID who happen to develop the loss of taste or loss of sense of smell. It's almost specific to COVID. Now, not entirely, because if you get your nose clogged up bad enough, you can't really smell very well, and smell is a large part of taste, So there's a little bit of overlap, but if you just can't smell or taste anything, I'm going to say, wonder if that's COVID. But otherwise, they're very similar.
Yeah. So I personally, growing up, and I've heard this a few times, like the stomach flu. Is that the same as the flu, or are they the same kind of idea?
Well, actually, you're right. Lots of people think think that the stomach flu is the influenza, but most people think of the stomach flu as anything that has to do with nausea, vomiting, or diarrhea. Okay. And it can go along with the flu, but that's mostly in children, not so much in adults. As Dr. Walker mentioned, the stomach flu is not influenza. Influenza is a respiratory disease, not a stomach disease.
Okay, so they're two different symptom patterns.
Correct.
Okay, great. So coming back to this idea of COVID and the flu, we need to protect ourselves. That's what it sounds like. We should get the flu shot. You've all mentioned it. You're all saying it. Well, what's in the flu shot? People are. I've heard so many things about what's in it, and so many like misconceptions.
So the flu shots each year contain at least 3, and this year almost all of them have 4 different strains of flu virus in the shot to try to get you to develop immunity to these 4 different strains. And which strains are in each year is based on what we think is most likely to come around. Part of that's based on what was prevalent the previous year. And you can get a preview when you look in the Southern Hemisphere that has their winter and flu season before ours to get a clue about what was going through at that time. You can use any, so there's probably going to be 30 or 40 different flu vaccines out there, and you can use any licensed flu vaccine that's appropriate for your age and for your medical conditions. And of the flu vaccines we have this year, probably about 20% of them are going to be what they call egg-free. That the main way to produce flu vaccine in the past was to grow it up in cultures that included egg proteins. But we now have a couple of ways to make it without any egg in it. So the good news is if you have a concern about an egg allergy, you can get an egg-free vaccine. It's actually, we worry about it less now than we used to. If the worst thing that happens to you when you eat eggs is that you get hives, which are those kind of itchy, small to large bumps on the skin, if that's the worst thing that happens to you, you can do any flu vaccine you want and you don't have to wait around for half an hour afterwards. If you're someone who gets symptoms worse than hives, the itchy bumps after eating eggs, you could still get any vaccine, but you should do it in a setting where you can be observed and they can handle a reaction if you have it. If I had an egg allergy, I'd probably just look for an egg-free vaccine. And probably the best way to find it is there's a website, vaccinefinder.org. And you go in there, you say, I'm looking for, you say, I want an influenza vaccine, you select the age range, and it will show you pharmacies near you that, or other locations near you with that specific type of vaccine. So that's one way to get it. If I will say, if you have ever had a flu shot or flu vaccine in the past where you had a severe allergic reaction, you should not get another flu vaccine, even if you think well, that was just because it was the egg one and I'll go get the egg-free one. What if you had if your severe reaction was to a flu vaccine, you are someone who should not get vaccinated, either by shot or nasal spray vaccine.
Some people too worry about any dangerous ingredients in the vaccine, and there's 2 particular ingredients: thimerosal, which is the preservative in the vaccine, and formaldehyde, which sounds horribly scary, but it's used to kill the live vaccine, to make it inactive. So many studies have shown that both of these substances are not harmful in the really tiny amounts that are used in the vaccine.
That's good. I was going to ask about that because those are common ingredients that people kind of bring up when they talk about vaccines. Dr. Rocky, you brought up don't get the flu vaccine if you get a severe reaction. Can you explain what severe reaction means? I don't want people thinking, I shouldn't get it at all.
Yeah, okay. That's a good point. So this is significant trouble breathing, wheezing. You needed medical intervention for the reaction you had. You needed an epinephrine shot for the reaction you had. If you have questions, what you should do rather than me trying to describe it, if you think you've had a severe reaction in the past, you should talk with a medical provider about the nature of the reaction you had and ask them, does this qualify as a severe reaction or not? And they'll be able to tell you.
I think this is a good time to kind of plug in that all three of these ladies here are clinicians in our center. So if you did want to talk to any of them, you can just email them at medicalshs@pasadena.edu and ask them exactly what Dr. Walker was mentioning. They're here to help, and they can answer these questions more specifically if they're individual questions for yourself. Thank you for clarifying that, Dr. Walker.
I realized there's one thing else I wanted to say. The frequency of severe reactions with flu vaccines is like 1 in 5 million. So this is not, if you know 3 other people who had the same reaction that you had, it's not likely to be a severe reaction.
Okay, that's good to know too. Thank you. So there's how do I say this? There's well, needles are scary. The flu shot has a needle. I've seen different kinds. My daughter gets them and she freaks out at the thought of it. What do you say to those who don't like needles?
Well, the good news is needles are not the only way to go. You can get a flu vaccine as a nasal spray vaccine. So it's a live attenuated virus. It's different from the shot. The shot is a killed virus. So you can do the nasal spray live attenuated virus, and there are age restrictions and medical condition restrictions that apply to it. Briefly, older than 2, younger than 50, and not pregnant. You need to know you can't have an immune compromising medical problem. You need to have a healthy immune system if you're going to use this nasal spray vaccine. And you need to not be around someone else who has immune system problems for about a week. There's more caveats to it than that, but it's a great choice for lots of people. The vast majority of people would be fine candidates for the nasal spray vaccine.
Great. That's great that there's another option for those who don't like it. Thank you. Dr. Walker, you mentioned something about how the East Coast gets the flu sooner than we do. And I know that typically for us, flu season is in December, or it's around there, but we're being told that we need to get our flu shot now. So why should we be getting it now? Carmita.
So let me answer that. So the regular flu season, we see it start in the fall. And normally it's recommended to try to get your flu shot around October. And we know the peaks for the flu season would be more December all the way through February if we're looking at a bell curve. But the truth is, getting the vaccine even now is fine because it will lower your chances of getting the flu. So they do recommend that adults and children starting at 6 months and older get their seasonal flu vaccine now. The sooner, the better.
Is there a downside if you wait later?
No, they still recommend, even if you're getting it in January or February, that you should still get it. I think you're trying to really, I'm not sure I would call it the downside kind of exactly, but kind of if that's how some folks might think about it, is I think that you really want to try to get yourself protected just before the peak season, right? Because it does take about 2 weeks for the body to create that immunity that you need to fight off that virus. So I don't know if that made sense, but I hope it did.
Oh, no, thanks for bringing that up, that it takes 2 weeks, because I've also heard that like the second I get the flu shot, I'm already protected. No?
Not true.
It takes 2 weeks. Thank you. So let's get into this COVID-19 and the flu. What are we looking at here? Why are we so insistent on the flu shot now?
Well, I definitely want people to know it's not because we think the flu shot can prevent COVID. It doesn't prevent COVID. We're still waiting for those vaccines, but it can both prevent or at least make flu illness milder than it would have been without the vaccine. And this is going to be really important because we are already headed into a really bad stretch of time with these rapidly rising numbers of COVID cases. The hospitals are not going to be able to keep up. If you just look at look back over the last 10 years, just thinking about the number of people who go to the hospital for flu each year, it's between 100,000 and 800,000 people every year who go to the hospital because of flu. Those are the hospitalized people. How many more of them went to the emergency room because they felt so sick? And this is not the year you want to be traipsing into the emergency room or need to be into the hospital, because you'll be competing for the resources with other people who are sick, and you'll get the chance to expose yourself to more people who are sick. So, try to take this problem off the table. You have to duck and hide with COVID for now, but you can help improve your odds with flu by getting the flu shot.
Yeah, thank you. In talking about the flu and the flu shot, there's a lot of things that people believe, or I think all of us have heard these very common misconceptions about the flu and the flu shot. So the whole part of this is we're supposed to be dispelling some of these myths. So let's talk about a few of these. So the first one, the very, very common one that I think a lot of us hear is the flu shot gives me the flu, or the flu shot makes me sick. What's that about?
I'll take that one. So the CDC actually recommended that the flu vaccine be an inactivated flu virus, have inactivated flu in it. So what happens is that this inactivated virus is sent to a lab and it's killed. And that virus is killed, it means it's dead. So it cannot give you the flu because the virus is now dead. So what it does at that point is once the inactivated virus is made into the flu vaccine, you're just injecting a dead virus to really help your immune system begin to recognize there's something foreign and create those antibodies that you will need, which takes 2 weeks, remember, to help fight that off. So this sort of started back in 2016 with the CDC's recommendation, and that whole pattern has been continued since. So that's not true. It's a big myth.
Okay, good to know. You mentioned years back, 2016 and such, and I know there was a few years where they said that the flu vaccine itself wasn't very effective, and that's now become like things I've heard is that, well, if it's not effective, so why even get it? People are still getting sick from the flu even after getting the flu shot.
Well, you're trying to find out. Well, what happens, let me go into this, is that by taking the flu vaccine, you actually reduce the risk of a flu illness. And that is running 40% to 60%, which is really wonderful. Recently, a 2018 study showed that among adults hospitalized with the flu, vaccinated patients were 59% less likely to be admitted to the ICUs than those who had not been vaccinated. Among adults in the ICU with flu, vaccinated patients on average spend 4 fewer days in the hospital than those who were not vaccinated. So that's pretty strong information to really try to encourage everyone to get their flu shot and the loved ones as well.
And that kind of goes back to what Dr. Walker was saying, that now is not the time to end up in the hospital. It is not a good time. So you want to prevent that as much as possible, right?
Right.
Mhm.
Yeah. I'm well, okay, let's kind of go into that. Well, if even if other people get sick, what if I don't get sick? So I've never gotten sick from the flu shot, so I don't need the flu shot. I've heard that many times. What's that
That
about?
is the one comment that absolutely drives me crazy. And my response to that is, you've been really lucky. Okay, you've just been lucky. And I read somewhere where one author said, millions of people don't get in car accidents, but they still wear their seatbelt. So I think we can sort of, compare that to getting the flu vaccine. But I think it really is a matter of luck. And there's so much out there now, including COVID, that why take, chances.
And I'd like to add one thing here. This is actually the person where I will tell them, you are the person I most want to vaccinate. Because if you have really never had influenza, it means that the day your luck runs out, you don't have anything to help you. That if you've gotten sick with flu every year, okay, it's kind of like getting a flu shot, but it's only one strain. I mean, you develop some immunity to that one. And so I look at it as putting another book on your shelf in your immunity library, that here's my 2017 immunity book, and here's my 2018, and here's my 2019. And in fact, it was back in 2009 that the H1N1 flu came around at the odd time of year. And did you notice? Well, one of the things they pointed out was the 65 and older people didn't die from it as much as the young people, because those 65 and older had seen a swine flu before. And so they got a little bit of help, even though it was distant help. And so, I'm glad they've never gotten sick, but now's the time to try to get some protection going, because they're not getting it from the diseases they've had.
And also, I'm sure we've all heard the word herd immunity. And what's really important, I think, is if you are selfish enough to forget about getting the flu, you have to think about the people that you're with, your own community, your own family, because the more people who are vaccinated in a community is best. So, yeah, I think that's important to remember too.
I think we all definitely heard of herd immunity. Valerie, could you explain what herd immunity is, just in case for the people that are watching who don't really understand it? I think it's a good point, because it kind of is similar to COVID as well, this idea of herd immunity.
Right. Well, and Dr. Walker, jump in, please. But herd immunity, the more people who are vaccinated in a community, protects more people in that community.
Yeah.
That's the simple explanation. But what do you think, Dr. Walker?
Yeah, you've got it. The point is, when the virus infects one person, it's looking for the next place to go. And if it has a hard time finding somebody it can make sick, then it's more likely to just kind of die out with the one person that got infected so far. But if everybody around that sick person can get sick with it, the virus says, yay, party time. And can infect everybody around them. And so you're looking, the people who can't get the illness help hide the people who could get the illness. And so for people who can't do a flu shot because they've had a severe allergic reaction before, they want everybody around them to be immune to the flu so that they won't get it and then expose them.
Thank you. Yeah, just because we've heard that in the news a lot. So it's good to have you explain it. So it's the clinicians are the knowledgeable ones. I'm that big vaccine thing. Vaccines cause autism.
Yeah, this one just won't die. It won't die, even though there has been extensive debunking of every theory about this. And, there's basically three things. The first of it started with thinking maybe measles, mumps, rubella vaccine, which is not the flu vaccine. This is one of the many childhood vaccines. But the question was, did measles, mumps, and rubella make kids more likely to have autism? It was a study of 8 cases of kids. And the easiest place to read about how thoroughly this has been refuted is probably go to WebMD. That was a real easy source, but it is not for lack of evidence that this was wrong. That this myth still exists. We'll still be talking about this in 5 years and 10 years and 30 years, but it is wrong. It does not cause autism. Now, one of the other thoughts was, well, that the problem with thimerosal, doesn't it have mercury in it? Yes, it has ethyl mercury in it. And that's only when you have a multi-dose vaccine vial. They've gone to hardly any of that anymore, just for this reason, because people were so flipped out about it when these questions first came up. And in fact, it's the reason why they took thimerosal. They made all the childhood vaccines, as many as all but one, is thimerosal free. Not because thimerosal causes a problem, but because the public was so worried about it. So what thimerosal has is ethyl mercury. The mercury that you don't want, those fish in the ocean that are poisoned with mercury, that's methyl mercury. That's a very different thing. So the extensive, again, as Valerie pointed out, extensive studies that thimerosal is not a problem, but that was one of the others. Well, maybe it's the thimerosal that's causing autism. And the third one was, when you give more than one vaccine at a time, if you give a lot of vaccines at one time, maybe that's a problem. This has also been totally debunked. Anybody who has a small child knows that they get about 25 different vaccines in the first 15 months of life, and it's no fun for anybody. But it is not an autism risk.
Wow. Thank you for clarifying that so well. It's so prevalent right now. And you're right, it hasn't died. It needs to go away. It hasn't gone away yet. I've also heard that antibiotics can treat the flu. No. Carmina's like, no.
No.
We'll all say no.
I'll also say no. And the
reason is an antibiotic is not used to treat viruses. And so the influenza is a virus. And by giving antibiotics to those who do not need it for a viral infection creates even a bigger problem. First of all, antibiotics are wonderful when taken as prescribed, meaning you don't take the one your grandma has somewhere. It's the one that's prescribed exactly for you. But antibiotics can cause some side effects. So we don't really want to open doors to things that we don't really need. Also, it's important to know that with antibiotics that are misused, it could cause different problems, not just side effects, but it can start the medication and the viruses start to become a little bit smarter, and the medicine won't work on that anymore. We're starting to, some students are aware of a resistance, the word resistance. So this building up a resistance to be able to treat an infection is not good. We need our medications specifically for what they are meant to be. So the antibiotics, and I know that folks ask their doctors, and our students walk in and they have a little sniffle or a cold-like symptom. Can I have antibiotics? No. The answer would be no. And there are times there's a little bit of a dialogue that goes on, and I'll say, look, let me just have you talk to Dr. Walker or one of the nurse practitioners. And they just go in the room and say, no, it's just not what you need for what you have. Let's look at over-the-counter medications. And the students really hear the message. And so I'm glad I got this message, because I run into this scenario a lot. So thanks.
So, what can somebody do if they do have the flu? Like, how do they treat it? If it's not antibiotics, how do you handle the flu if you're sick?
So it's mostly what we call supportive care. That if you have a temperature over 100, we're going to tell you use what's safe for you to use to bring your temperature down. Get enough fluids, because once you start being hot, you lose fluids at a really rapid rate. Try to get enough rest. Stay away from other people. Tell them to go away, that they do not want what you have. If you find that you are unable to get enough fluid to feel like you can stand up and go to the bathroom when you need to go without feeling lightheaded, you may need to talk to somebody. If you are so sick that you can't take care of yourself, you need to get somebody to help you. But the vast majority of the time, people will get over the flu without needing anything beyond what they can do for themselves.
Okay, that's good to know. Thank you. So another one that we've heard is, and I think Dr. Orr, you kind of mentioned it, but I got the flu shot last year. Why do I need to get it again? How is this different from other vaccines?
Well, each year there can be different kinds of flu strains. So what you got last year worked for the last year's strain, and this year's, there's a lot of research that goes into what particular strain of the flu is put into the flu vaccine. So it's appropriate for that particular season. So one given in 2016 is not going to help you for this year.
Okay, thank you. A while ago in our conversation, somebody mentioned that pregnant people shouldn't get the flu shot. Is that?
No.
Carmita's shaking her head again. Oh, everybody's shaking their head.
No. So pregnant women should be getting a flu shot. And the CDC and ACIP said any time during their trimester is fine to get the flu shot. The flu vaccine has actually helped reduce the risk of pregnant women being hospitalized by 40%. So that is really important for the mom to take that proactive approach to help the baby as well. I know that the word thimerosal has been thrown out a little bit out there, and what the recommendation is for pregnant women is to have the preservative-free vaccine. So that would be one thing to really consider. Now, remember that the baby, when the baby's born, doesn't really have a lot of immunity. So by having mom have the immunity against the flu vaccine, it'll help to transmit that virus to the baby. I'm going to just step out even.
You mean you said transmit the virus? You meant transmit the immunity to the baby. The baby
transmit the immunity, right? But too, what we want to know, the babies, as they're still young and their immunity's developing as well. I'm going to go out a little bit by saying I've heard this term before, cocoon. So maybe the folks that are going to be taking care of the newborn, the dad, the siblings, the grandma, the neighbor, whoever, should also be mindful and have their flu vaccine.
Thank you. How about those that already got the flu? Like, do they still need the shot?
Yes. And there's a couple of things here. One is, do you know you had the flu? You might have had, or did you have a flu-like illness? You don't necessarily know which one you had. Now, if you actually went to someone to get tested, there are rapid tests for flu. Rapid tests for flu have some of the same problems that rapid tests for coronavirus have. They're not necessarily very sensitive, or they may not be. There can be problems, but many people don't even get a test. If tests are done, sometimes public health takes a certain number of respiratory samples, of swabs done of people, to try to look to see, okay, is there flu here and which strain is it? So that as the season goes on, they can tell you, well, we've been seeing mostly influenza A, or it's been mostly influenza B, or this one, that one. But most of the time, you're not going to know that. So first off, you don't know if you had the flu. Number two, we already told you there's 4 different strains of vaccine in the flu vaccine, and you only had one illness. You're still ready and raring to go for the other 3, even if what you had was in the vaccine. So yes, when you get well again, well enough, you can have a mild illness, low grade temperatures under 100. We'll go ahead and vaccinate you with a mild illness. If you're moderately to severely ill, we'll say, maybe we need to wait. But, once you're mildly ill or less, let's go ahead and vaccinate you and hopefully protect you against the other ones. Now, and so why are we, good news is the patient population we deal with at Student Health, they are mostly people who are likely to do okay with the flu. It's going to mess with every part of their life. They're going to be out of work. They're going to be miserable, typically for 4 to 5 days. But even though that's the usual good outcome, even healthy young people die of flu. And that is such a tragedy. I mean, just overall, death on a yearly basis, death from flu is anywhere between 12,000 people and 60,000 people in the US. Those are deaths that maybe didn't need to happen, and getting a flu shot is one way you can help protect yourself. If you're also doing a very good job of social distancing and masking and washing your hands, it's going to help you with the flu as well. But that the US as a whole is not doing a good job with this, because we would not have the skyrocketing rates of COVID that we currently have. So, we're definitely still vulnerable to flu.
That's so true. And I think that's probably the biggest message here is we can still get sick from any of them. I just checked on our social media accounts. I put up if anybody had any questions that they wanted to anonymously send in. And somebody asked, they said they're on their parents' insurance, but their parent doesn't believe in the vaccine. How do they get it?
Okay. So first off, if they're over 18, for something like this, younger age for some other issues, but if they're 18 and older right now, they are an adult, and they're even though the subscriber is the parent is not really allowed to get any specific information about an encounter that adult child may have had with their medical provider. Also, you could walk into any CVS, Rite Aid, Walmart, Walgreens, and buy a flu vaccine, and it's probably going to be like $25 or less. Carmita, do you have something?
Yes, Costco has it for $19 and you don't have to be a member to get it. So
Okay.
just, yeah,
So
you need to be 18, I think.
don't let a boneheaded parent keep you from doing what's right for you.
That was going to be my next question. Actually, somebody was asking, where can I get the flu shot? I think this person probably thought, because we usually give it every year for free. So can somebody talk a little bit about what's happening right now?
Well, they're right. We usually make arrangements, and in fact, Carmita does most of the work on this, makes arrangements to get free vaccine from Pasadena Public Health. And then we set up flu clinics outside on the quad. And this year with the pandemic, it was not a good idea. And so over the last several weeks, we've been posting in the COVID update about free flu clinic opportunities that we knew about. Most of the mass free events are over now. There are still lots of medical service providers within LA County that will be low cost for many people and free for some people. And we will continue providing the link to the list of those medical services places. And then you just kind of pick up the phone and you start dialing and saying, have you got flu vaccine? How much, what would I have to pay to get it? Carmita.
And most insurances cover the flu vaccine. So if you have health insurance, then it should be covered. And most pharmacies, 95% is what a pharmacist actually told me, they will do the billing to your insurance companies. So I just wanted to bring that up as well, because that's another way.
Yeah. And it used to be with insurance, they would say, we only want you to go to a CVS, or we only want you to go to a Walgreens. I think it's gotten a lot looser in the last couple of years. But if you have an insurance card, there's going to be a customer service number on it. And you call that number and you say, how do I get a flu shot? And where is it free? And they're going to tell you, this is stuff they know. They deal with it all the time. They want you to get the flu shot because you are a less expensive patient to them if you don't get sick with the flu.
So what about those who are uninsured? They don't have insurance. How can they get the flu?
So again, you could, if you got the cash, you can go into any pharmacy and buy it. Okay. If you don't have, you could look on our community resources link on the Student Health Services website for some of the low cost, no cost medical care clinics in the area. Some of the LA County runs several different offices. The CHAP Care offices are part of it, but there's many others out there. And they're going to do things by sliding scale, and they're going to be very motivated to vaccinate people who come to them, and they're going to do their best to make it affordable for you.
So if you have insurance, if you don't have insurance, the message is get the flu shot. There's no excuse not to.
Yes.
No excuse.
Thank you all. Those are the questions that I received through social media, and you've answered all of the questions that have been coming up recently. So thank you so much for joining us today, and thank you for watching, our viewers. This is going to be really informative. Even afterwards, we can share this information with a lot of different populations who want to see it. So I can't say thank you enough to Dr. Walker, Valerie, and Carmita for joining us today. And thank you to everybody else for being here and watching us today. If you have any questions, you can message medicalshs@pasadena.edu, and they will reply to you within 24 to 48 business hours. And I think I can safely say that, right? That if you have any flu related questions, somebody, a clinician will be able to answer them.
Oh yeah.
Good. I'm glad. Yeah. And we also have a phone number, but our email is the best way because we can get back to you sooner in that regard. And I'm sure email is really great for everybody. But again, thank you so much for joining us. Thank you for being here with us, everybody. I hope you have a good day.
Thank you. You're welcome. Bye-bye.